Okay, so my name is Emily Ryan. I'm the director of the Commons, and have the pleasure of welcoming you today. Educate and Act, of which this is the 13th episode or session in the series, is a series that began when the Center for Service Learning, the Emily Taylor Center for Women and Gender Equity, and the Commons came together to um, bring to fruition a series of events that addressed ways in which people can be engaged in democracy beyond voting. Voting is obviously an essential part of it and one that people talk about a lot, but there are so many other components to it too, as you all know, in that you're here today. So this series is really a way of trying to tie together research and action and participation in systems at all levels, whether they're local, national, international. So that's how Educate and Act came to be. And we started at the beginning of 2020, and here we are. So today's topic, as you know, I'm sure, which is why you're here, is August 2nd and abortion policy, a case study on organizing voters. And we'll be hearing a lot about what lessons have been learned as a result of last August's vote. And at this point, I'm happy to hand over the microphone to my colleague, Nikita Haney, who is the director of the Emily Taylor Center for Women and Gender Equity, and who will introduce our moderator today, I think.
Good afternoon, everyone. Thank you so much, Emily, for introducing the event. As Emily stated, I am the current director of the Emily Taylor Center for Women and Gender Equity here at the university. And I have the pleasure of introducing our moderator this afternoon. So Pere DeRoy, using the pronoun she, they, is a Caribbean North American scholar. She is a doctoral student in the Women, Gender, and Sexuality Studies program at the University of Kansas, with a specialization in public policy and administration and Caribbean studies. She holds an MA in development studies from York University, Canada, and an MA in women, gender, and sexuality studies from the University of Kansas, a postgraduate diploma in international studies, and a BSS in sociology from the University of Guyana. She conducts research on health disparities and equity in reproductive health outcomes, anti-trafficking, public policy interventions, immigrant livelihoods, and the global political economy, race, sexuality, and gender hate crimes and inequalities, gender-based violence, LGBTQI human rights, and sexual and reproductive health rights, and particularly for queer and trans BIPOC populations transnationally. She has over a decade of civic engagement and experience working with development-oriented organizations ranging from non-governmental to intergovernmental and state agencies in areas of program management, community consultation, and resource mobilization focused on education, mental and reproductive health, women's and youth advocacy. Pere works constantly, challenges and expands ideas of freedom and self-determination through the reproductive justice framework. And so without further ado, I'm going to pass the mic over to our wonderful moderator, Pere DeRoy.
Thank you so much, Nikita. Hello, everyone. Thank you for being here. Also, thank you to the panelists, which I will focus on in a bit. Before we get to the panelists, I want to give us a moment to focus on the context of this specific conversation today. So in June 2022, the US Supreme Court overturned Roe v. Wade. And this decision paved the way for individual states to pass legislations to maintain, curtail, or outright ban abortion rights. Over the summer of 2022, for the people living and studying in Kansas, they might have witnessed a lot of conversations, rallies, roundtables, debates, and information sharing around abortion rights. And in the month of August 2022, voters in Kansas with the interest of protecting abortion rights showed up and won by a margin of 59% to 41%. These voters led to the rejection of the proposed state constitutional amendment, which means that Kansas will continue to have abortion rights and its associated services protected. So what I want to know, I want us to have a meaningful conversation today on, how did this victory occur? Let us take the time to reflect with and learn from the people who've been mobilizing the population in the direction of protecting abortion rights. Let's talk about civic engagement and the no vote outcome. So as I turn to the panelists, I would like to ask you to introduce yourself, the organization, and respond to the question of why civic engagement matters in terms of the abortion rights conversation. Which I have many persons on the screen at the same time. So I don't have a mic to pass around. So do we want to, should I call on names or should, how do you feel? Call on names? Okay. So let us move to Sandy Brown.
Hi, everybody. Good morning. My name is Sandy, and my pronouns are she, her. I'm the president of the Kansas Abortion Fund. We are a small organization, but all volunteer. And Pere, wanted you to, could you repeat the question? How civil engagement?
Yes, yes. I'll repeat the question. Why civic engagement matters to this specific conversation?
Right. It matters because there seem to be, there are legislatures and there are people who vote, and those two entities don't always coalesce. As we have seen, we won the vote by a huge margin, and yet even in our own state of Kansas, the legislators are still fighting with us, are still trying to make the landscape even more difficult, or let's say as difficult as they can. We have got to, at a grassroots level, take this on. If it doesn't happen at a grassroots level, I'm not sure it could have happened. There were just so many amazing people that were involved. And I would say that everybody here had a hand in this. There are some people who were the leaders, and some people just showed up and gave it all they had. Like the Kansas Abortion Fund, we attended the events, we spoke, we had fundraisers, or people had fundraisers for us. But without civil engagement, the energy and the purity of the cause isn't there.
Thank you and welcome.
Thank you so much.
I'm not sure I'm saying your first name right. Is it Nazir? Right, Rija, Nazir?
Yes, Rija Nazir.
Well,
so my name is Rija Nazir. I'm the lead organizer for KS Vote Neigh, which was a Western themed Vote No campaign. And so we kind of took on that play of words to attract younger populations to be more involved in this campaign. And so our focus was on getting young people to get together and get their neighbors, family members, friends more involved in this campaign. And oftentimes with very serious campaigns such as abortion rights, you kind of feel this sense of doom and impending doom, and you don't really know what to do. And so having small asks of our followers, such as sharing posts, telling 3 or 4 friends or family members or neighbors, was very doable for them. And so that kind of led to us partnering with Candidates for Constitutional Freedom and kind of leading them to do text banks and phone banks and canvassing. And so that was kind of the biggest part of our campaign, was mobilizing young people who often feel like they don't know what to do in these types of campaigns.
thank you and welcome.
Thank you.
Melinda Lavon, did I say that correctly?
Yes, thank
Perfect.
you, Pere. I'm Melinda Lavon. I use she and they pronouns. I'm the chairperson of Vote No Kansas Political Action Committee. My approach to civic engagement was generally very heavily partisan, whereas most of your panelists are involved with some type of nonprofit, like a structure that is a 501c3 or C4 advocacy organization, and a political action committee. Not that I support Citizens United ruling. I think PACs are terrible, but it is a useful vehicle for getting votes, and that was my biggest focus. We were operating on data that was collected in 2021, actually by the Lawrence DSA, Democratic Socialists of America chapter here in town, where we were able to extrapolate from that, focused on the 100 rural counties in Kansas. About half the Kansas population lives in 5 counties, and then you have the other 100. We calculated that we had over 600,000 people that were with us on voting no. They were people that generally do vote in even year elections. And I just wanted to bring up that the next abortion ban is going on the November 2024 ballot, because that movement is counting on us to be apathetic during the presidential cycle. So civic engagement for us was pretty heavily partisan, but at the same time, at event in all these different locations, you had people that may not even be registered voters or registered under any different way, marching together in the street to work together for a common goal. And I think that not bipartisan, but all community engagement in each location was really, really key.
Thank you and welcome. Nigel Morton.
Hi, so yeah, my name is Nigel Morton. I use he and him pronouns. I'm the senior Kansas organizer for URGE, Unite for Reproductive and Gender Equity. I'm based in Wichita, and we're a youth-led, youth-driven reproductive justice organization, which I know we're going to get into the difference between reproductive justice and reproductive rights later, so I'll save that explanation for another time. So we usually work mainly with college students through our college chapters. We don't engage so much in the legislative process or the electoral process as some of the other orgs here do, because we're really focused on being a political home for young people where they can engage with theory for the first time and learn some basic organizing skills before getting plugged into the larger movement. And though that's how we normally operate in Kansas, we did we hired 8 paid canvassers to make phone bank calls for us, focused on people who are usually left out of the data when it comes to voting. So young people of color in certain neighborhoods in bigger cities and in rural areas. And civic engagement matters here for a lot of the reasons that folks have already shared. But I really appreciate what Sandy shared about how grassroots is like civic engagement needs to be, and how as it was in this process. We did our best to try to engage as many groups as we could possibly, and there were a lot of groups that popped up on our own. Like I still am not sure how many like loose unaffiliated or organizations of people showed up and like organized their own neighborhoods. So civic engagement can look a lot of different ways, from like nonprofit, political parties, even to just like neighbors getting together. And so like all of that contributed to the victory.
Yes, thank you. Absolutely. Lauren Klapper.
Thank you, Pere. Yeah, my name is Lauren Klapper. I use she, her pronouns. I am a Kansas organizer with Planned Parenthood Great Plains Votes, which is the C4 advocacy arm of Planned Parenthood Great Plains, which provides healthcare, mostly focusing on sexual and reproductive healthcare to Kansas, Missouri, Oklahoma, and Arkansas. So yeah, I'm thrilled to be here today. I think all of the panelists had great reasons for why civic engagement matters, and I'll kind of echo what they said and just lift up that, you know, our legislators in the state house, they're not experts on abortion care or reproductive health care, and I think that our communities are, and so that's why it's important that you know, we're using our voices to advocate for ourselves and our communities, and because we know what's best for us, and oftentimes they don't. So thank you.
Thank you and welcome all. You've mentioned in the sharing of the work you do, some of the strategies of your organization and the population within which you target. So I want us to focus on, for a minute or two, what you did in your campaign. I think living in Kansas, there wasn't a time I went in the classroom, I'm in the classroom, I'm at this grocery, I'm everywhere, and there is a conversation. And again, going back to the question, how did you do it? How did you do it? So what are some strategies and tactics that you utilize, do you want to share to really get that you can say led to the no vote being successful?
I would have to say that the Kansas Abortion Fund, we did a lot of listening. We listened to not just those of us in the movement, but we listened to everybody, and it inspired us, and we needed to answer back. So for example, being volunteers and the people on our board, they work full-time. I'm retired now, but they work full-time. So there was limited capacity to put a lot of energy into this, but we attended the events that were organized. We tabled. I think that we became bolder and louder. I would also say that we engaged with people who we may not, and on a personal face-to-face level, with people that maybe we would never have been able to do that before. This was really enriching for us. And I think we started to develop a snowballing effect. We also responded day and night to the media requests. And to this day, I have connected with people in the media, NBC News, et cetera, who constantly come back and say, hey, Sandy, what's new? What's happening? Being involved with the media was crucial for us. The other thing was we didn't say no to the fundraising events that people wanted to do for us. They actually wanted to have an event for us, a barbecue in Bonner Springs, you know, on a rainy day where there was a big giant tent and a band playing and barbecue and just so that's like the ultimate in grassroots. I loved that so much, and I'm still in touch with those people. In fact, hoping to bring one of those people onto our board. So we really, for us, it was rubber to the road. It was dirt, boots on the ground. It was getting over some fear of sometimes speaking extemporaneously to people on the cuff. It was engaging in people in the grocery store lines and saying, you want to know what to do here? I'm going to give you 2 email addresses, or here's 2 links right now. So bold and loud is what we became.
Yes, thank you.
I can go next. For Vote No, it was doing a lot of visiting, right? Especially during COVID, or if you think about politically that urban-rural divide that got worse in 2016, starting to repair some of that rift. I visited 56 counties and 110 different communities and helped people organize all these rallies and days out at the park and whatnot. And sure, sometimes we had 20 people come, but those 20 people went out and told at least 5 more. We definitely employed ideas like vote tripling, where we ask somebody to tell at least 3 friends and ask them to do the same. And then in the fall in Montana and Kentucky, definitely got to employ some additional text messaging strategies. It turns out if you give people a choice of can you tell 3 or 5 friends about this, you get a lot more enthusiastic reaction with higher response rates. And most people chose 5 instead of 3. And we beat the abortion ban initiatives in Montana and Kentucky, same way, working with a larger coalition of folks. I think that when we look at the votes and the voters that we're going to need to change the legislature so that we don't continually have to do this on a repeating cycle, employing some really key rural organizing strategies are really important. And that includes yard signs, field signs. Text banking is really helpful, but not always because more people have landlines in some areas. But having in-person community events, like Sandy said, connect with people that you would never normally talk to. I would not normally talk to somebody that's a registered Republican in Abilene, Kansas, but she was with us on this one issue, and that's why she was there, and I got to talk to her. I think I wanted to mention 3 books that have really important rural organizing strategies in them that you may not have thought about, especially if you've lived in more urban areas most of your life. Dirt Road Revival, Harvest the Vote, and then Power Concedes Nothing. Those 3 books were actually pretty helpful last year for us. And I think they'll be key in 2024 when we look at electing more pro-choice legislators.
Yes, thank you. And thank you for those 3 books. I think we'll be able to have them in the chat, in the group chat, and that, maybe we can, attendees can take a copy, get a copy somehow. But yeah, thank you so much for that.
I'll add that I think one of the most important things that we did was just talking to voters, whether that was on the phones through phone banks or door-to-door through canvassing. That's something that a lot of the folks on this call did. I know Planned Parenthood Great Plains Votes started doing that back in fall of 2021. And then with our coalition, we were able to build up capacity and do that. So where we were contacting voters almost every single day over the summer. And so that's, I think, really the big piece of this is that, we have to have those conversations with our neighbors about why this is important, and also make sure that, they know how to vote, they know where their polling place is, make sure that we keep reminding them. I think that was a really huge tactic that we used, and a lot of why the margin was so high. So.
Yeah, we used it.
Oh, go ahead, Nigel.
Sorry, I don't even know who I'm cutting off because my big face is on the screen now. We did a lot of similar things to what Lauren was sharing. Our organizations were actually part of the Kansans for Constitutional Freedom campaign, which led a lot of the more different types of messaging. Like, we were able to come together under like a unified message, which was helpful for talking to broad groups of people. But for Urge, we had our own team of 8 phone bankers who were calling those like more specific lists that don't always get included in a lot of like larger electoral campaigns. And then we also, so like anybody who's been in the movement for the last really 5 to 10 years knew that Dobbs was going to happen, especially like after Dobbs got introduced in SCOTUS. So we used a lot of our lead time to plan out community engagement events. So it got released right around the same time as like a lot of Pride weekends. So we were already set up with tables out there to meet voters where they were, to get the questions. And we did get questions like, why are you preaching to the choir on this? Because it's a Pride. Most people that are going to a Pride in Kansas are probably already going to be on our side. But I mean, as we've all learned, that there's so many barriers to knowing what's going on in the legislative sessions, in what's on our ballot. I mean, they didn't word the ballot. I think it was like 30 words per one sentence, I think is what one of the sentences on the actual question was. Like, there were just so many people who were confused and needed clear information. So our canvassers really tried to meet the community where they were at the events they were already going to and just answering their questions, and trying to make information as accessible as possible. And also just like kind of like an obligatory thing, I do have to share that URGE is a 501c3 organization. So other folks are talking about candidates and that's great, but we focus on nonpartisan issues and non-candidate issues as well.
And
Thank you, Nigel.
Oh,
So, sorry, who
I'm
Lauren?
just going to, sorry, my Wi-Fi keeps cutting out. Okay, I'll just add that Vote Neigh definitely had the opportunity to share all of these great events that all these other organizations were doing. We were predominantly just doing online type of activities and informationals on our social media. Specifically, one of my favorite things that we did on our social media were our testimonials. So we had people from all over Kansas, specifically younger folks, who sent in pictures of themselves and a quote of why they were voting no. And it was quite refreshing to see people that we knew, that we didn't know, and just talking about what was really important to them. And it provided over 30 new perspectives to voters on why they should vote no. And aside from that, we were just kind of adding reminders. Okay, here's the last day to register. Here's the last day to request your ballot. And so I believe that staying online for us was very beneficial to helping young people, and just a regular reminder on what to do on a certain day.
Thank you. Anyone else want to add a comment to this question? Yes, thank you. And you know what we see coming out here is the relevance of understanding your audience, the relevance of like understanding what strategy or tactic to use to get the best outcome, to get more engagement. And I like also what you're all saying, but one thing that stood out to me is what Sandy said, listening. And I feel that goes in like both ways. We as or you, the organization has like you have something to say. At the same time, persons who are not sitting in that public space, they also have something to say. They also have an opinion. They also want to understand more. So being able to connect, and as Nigel said, set up tables, ask questions. Oh, you don't know how to do this? Let me tell you here, here we have resources. We're online, or we know you're online. Let's talk online. And I feel like this really showed this not just holistic, but it's just from the different approach, a multifaceted approach in which it was taken in what you're doing. And it's I want to know if you had a specific audience, like who did you target specifically? Did you say, okay, we're going to target everyone in Kansas, or you, understanding your capabilities, had a specific audience that you were targeting, and why?
For Vote No, it was registered Democrats, registered unaffiliated voters that have voted in an even year election in the last 10 years, and also Republican women age 35 and younger. That's who we primarily reached out to, designed information for in English and Spanish, and text banked.
May I ask why?
Because the data that we collected in 2021 indicated that these voters, one, are probably going to vote if a big thing is happening, so we better get to them, and two, they are potentially going to vote no.
Thank you.
With the Kansans for Constitutional Freedom Coalition, we focused a lot on the Big Five, or most of our resources went to the Big Five counties of Wyandotte, Douglas, Johnson, Sedgwick, and Shawnee, just because we knew that that was where a lot of our supporter base was, and there was a pretty strong organized structure already in those counties. And so you can, and Vote No kind of focused on those other counties that we didn't get to, and so that was a great way that we were able to make sure that we reach the whole state. And I do think that there were things done as well within our individual organizations, but also within the coalition to try to reach specific populations. I know in the last month, Planned Parenthood Great Plains Votes made sure that we had canvases in Wyandotte County just as often as they were in Johnson County, because Wyandotte County is a county that isn't often focused on as much as in campaigns. We focused a lot in the central and eastern portions of the counties where there are a lot of Black and Latinx voters, really making sure that we were, meeting people where they were at, and we had some bilingual canvassers as well, so they could talk to Spanish speakers in KCK. I was able to lead a Spanish-speaking phone bank towards the end of the campaign to make sure that we could try to follow up with as many Spanish speakers as we'd reached on the phone in their own language. And I also just want to shout out New Frontiers Project. They did a lot of work in Southwest Kansas around Spanish-speaking voters. So I'll let other people chime in, but I mean, I think we really all, and this kind of, I think we'll talk about later about how we work together, but I think we all just kind of focused on what we did best and let people fill in the gaps and their strengths. And I think that really worked to our advantage.
Yeah, absolutely. And you know what? Maybe we can go right into that, right? The collaborations. We can go right into the collaboration working together. How did you partner with each other in terms of this period? And what was that collaboration like? Who did you collaborate with? Go ahead.
All of us were part of the Kansans for Constitutional Freedom Coalition. That coalition work was vital because it stopped us from duplicating efforts and wasting resources, and not just money, but our own individual, like Sandy mentioned, where there's, when you're also working a job or you're raising a family or, you're doing things, and there's a limit to how much each one of us can physically do in a day or as a group. And so not wasting energy and resources was vital because we had that communication and that collaboration. I also think that we all did an excellent job of, we did not agree on things. We did not work from the same set of data. We did not have the same win number. We did not have the same approach. We are not the same type of organization, as Nigel pointed out, but we had the same goal, and that's all that mattered. And we stayed focused on it and cooperated throughout the whole process. And I'm excited to see what we'll end up doing together for 24, because we will need to work together.
Yeah, thank you for that. Anyone wants to talk a little bit on solidarity, on why, like, what do you see, like, the lessons from the collaboration?
Oh, go ahead, Sandy.
Yes.
Okay, sure. Yeah, the collaboration was amazing. I mean, yeah, Melinda, man, you are amazing. Nigel, Lauren, it was really powerful because we didn't know each other, but we all had a powerhouse behind each of them. Melinda had a powerhouse behind her. Nigel had a powerhouse behind him. I wanted to go back just for a minute, if you don't mind, Pere, and discuss, we were talking about reaching out to specific people, the people we were speaking to.
Yes.
I was thinking that one lesson for me here was speaking to the national media. Now, I happen to be a little bit more on the radical side, but I knew that if I was speaking to a national audience, I didn't want to turn people away. So I did, I would say, create my language to be more inclusive. You know, how do you discuss abortion with the national news? I felt as though there were certain phrases that I was using and repeating that hit home with more people. For example, bodily autonomy. You don't have the right to make a decision about my body. Those were the things that I felt spoke to people, regardless of gender or regardless of who they were, what political affiliation. I tried to speak along those terms that really dealt with the medical issue. Everybody has their own story, and you don't have the right to take away somebody's story if they have a fetal anomaly, for example.
Yes. Thank you. Nigel, you want to go?
Yeah, I was gonna hit on your original question for this portion about like working together in solidarity. I think like when you take out government systems like the IRS that we all have to report to for our organizations and government structures like that, like we all understand what the issue is. Like we operate under different titles and everything, but we all know what the problem is, and we know that like we're better together when we're using our resources effectively and like really staying in like the lanes that we have our expertise in, and like just collaborating and not stepping on each other's toes. And I think it was very challenging at parts, especially when it got closer to GOTV, but like we still held each other together pretty well. Like we still, within those disagreements, I believe we held each other with compassion as much as we emotionally could at our loads. And so like I'm just like really proud of like how we were able to like try to like exist within a legal framework that limits what our organizations can do, but also like come together and contribute to the larger win.
Yes, thank you. Rija, are you with us?
Yeah, I was just gonna, I have the same exact points, just working together. Aside from Kansans for Constitutional Freedom, Vote Neigh was a part of the Kansas Youth Power Coalition, which had some of the same organizations such as Urge, Sunrise, and Progeny, and I can't name all of them off the top of my head, but there was a lot of amazing youth groups who did amazing work in this election. So that's really all I had to add.
Thank you. And you know, when we're gonna open up to the attendees in a bit, but I just want you to know that I also felt that, like, you know, I felt that collaboration, I felt that solidarity from the people working behind. Because everywhere you go, the referral, it was the strength of the referrals that you can tell that there was a collective conversation happening from the people who were from the organizational perspective, from the youth groups. You know, you can feel it. So having that come to the front right now, it's absolutely good, because then you can connect the dots. This is why we got here. And you know, I want us to bring us to the question of how we're thinking about the issue, how we're engaging. And some people use different frameworks. Some people say this is a reproductive health issue. Some people say it's a reproductive injustice or justice issue. Some people say it's a reproductive rights issue. This is an abortion positivity issue. Like there's so many different frameworks persons use to present what they're feeling and what they want to see happen. What framework did you use and why? Did you use a framework?
I mean, I can chime in and start talking about reproductive justice. So like I mentioned earlier, Urge focuses on a reproductive justice framework when we're approaching these issues, which, to define it for people who may be unaware, it is different than a reproductive rights framework. And Sister Song, one of the founding organizations, defines it as the right to have a child, to not have a child, and to parent the children that we have in safe and sustainable communities. And all of that is centered in an intersectional, like Black feminist theory, and focusing on the experiences of Black people with multiple marginalized identities, which, if you're familiar with the term intersectionality, you know that that was a term coined by Kimberly Crenshaw to describe this unique oppressions by Black women. Historically, the organizing behind reproductive justice has always existed by the folks with those lived experiences. And so the term came around in the 90s, and organizations formed to really carry a lot of that work forward in like more policy and legislative spheres. And URGE does take a multiracial approach to it, and it like want to honor as much that it does come from Black feminist theories. And it really, I think, hits at like a core principle that, like, if we improve the conditions of the most oppressed in our society, everyone is going to benefit. The person who, like the white person who is like struggling with the unemployment system or registering to vote, those systems are designed to oppress Black people, and we're just kind of caught in between. So if we can start to recognize like where our oppressions are common, and listen to the folks that are most affected by something, then we can really start to really get to the point of change, like point of agreement and point of change. I hope that all makes sense.
Yes, thank you, Nigel. Yeah.
Vote No Kansas was run by all Democratic socialists, and so that intersectional socialist framework was probably just our value system that we applied and tried to make clear in our communication. Like, we talk about pregnant people, and actually URGE's leadership was really informative on just terminology, you know, and how to be as inclusive as possible. And also, we tried to also use as clear and plain language as possible as well, so that we could really just try to clarify what we're trying to say. You know, when you try to read a bill or try to understand an entire political, social, legal system that we're all trying to work in, all these different frameworks and structures that we didn't create, we're just dealing with them, feeling the effects of them. But I think that organizing the working class and the poor and focusing on that class struggle, because like Nigel pointed out, you know, people living in poverty in general struggle to access abortion. And then it's just disproportionately affecting different populations like Black Kansans. And we see that in our maternal mortality review committee that the state of Kansas has. The disproportionality in those deaths are just exactly what you would expect them to be, about 4 times higher. And then Indigenous even higher than that. I'd like to hear what framework.
Yeah, I think Planned Parenthood Great Plains Votes tends to come from more of a reproductive rights framework. We have, honestly, mostly just because we prioritize advocacy that affects like what care we're able to provide to patients. You know, we've tried to start doing some work around reproductive justice and abortion positivity, you know, just like informing our supporters about the importance of eliminating abortion stigma, and also just, you know, the importance of, when we're thinking about, you know, this vision that we want to work towards of, you know, where all people can access abortion and all forms of reproductive care, it's important that we're centering BIPOC folks and the folks who are most impacted by, you know, the restrictions and bans that are already in place. So we have a lot of work to do, and we know that we need to do it. But I think one thing I did want to say too is just, you know, we've tried to move away from using pro-choice, just because that often, you know, it doesn't fully encompass everything that needs to be a part of this conversation, you know, because if we're just talking about whether someone has the right to choose, oftentimes we're leaving out that even if they have the right to choose, they may not ever be able to access that care because of barriers like transportation or childcare or just the cost of the services themselves. So yeah, I think just kind of moving beyond being pro-choice is one of the first small steps to really work towards centering those BIPOC communities.
Yes, thank you. Yes, Sandy.
Thanks, Lauren. That was really great. We Kansas Abortion Fund, we came from a place of we get abortions done. We get them paid for. So we tried to come from a place of, well, you know, this year we have funded 486 people. Those people ranged from 14 years old to 46. They came from 44 out of the 105 counties in Kansas. So we try to focus on the procedure of the abortion as a procedure. If you're a Kansan and you need to have an abortion, we'll fund you wherever you go in the country. You just have to be a Kansas resident and be poor. So we tried to come from it from a place of need and really drive it home to the specific person. You know, you start thinking about that 14-year-old or that 46-year-old who's a farmer's wife and has 3 kids and can't afford a first trimester abortion at $750. So that's where that was our framework.
Thank you. Anyone else want to make a comment on that question?
I was just going to add that a lot of Vote Neigh's methods and strategy and language came from these organizations such as URGE, Planned Parenthood, Vote No, and KCF, kind of taking bits and pieces away from them and adding it to our campaign. So I'm very grateful that they have a lot of that education accessible to everyone and to our campaign. So yeah.
Yes, thank you so
Also,
much.
Sorry, I forgot to mention a resource that I'm going to drop in the chat real fast.
Uh-huh.
It's just a good kind of primer that breaks down why abortion bans are racist. It's a new URGE campaign that we launched.
Perfect, thank you. This is going to be my final question before opening up for questions and answers. We've talked a little bit, you know, we touched on a little here and a little there, and we're reflecting, and I think reflections are always good for how we move now and how we move in the future. The lessons that we take from collaboration, like the tactics we've used. So my question is, what's next for your organization for this conversation?
Well, educating people about House Bill 2181 for starters. A professor at Wichita State University did an analysis of where Vote No won by more than 50% in the new districts, because remember, we just did redistricting. And so, you know, on the political side of this, you know, there were a lot of House districts where Vote No won by even 55% or more, and no candidate that supports abortion access was on the ballot. And that is not going to happen in 2024. And there are a lot of people involved in identifying candidates, so that again, we don't have to do this every 2 years. This is crazy. And also, let's think about how hard everybody worked last year to just preserve the status quo. Right. And the status quo is terrible. It's terrible. The number of forced births that we have, not through anybody's fault here, is just the accessibility piece of it. I mean, KAF only has so much money. Planned Parenthood only has so many providers and places and things like that. And we keep getting access to telehealth and then not telehealth. And then maybe Walgreens is going to save us and maybe not. It's a vastly shifting landscape for all of us, but we will all still be here. we are all working already on the next round, and I'm confident we'll find ways to work together.
Thank you.
Yeah, I think I'll just say, I mean, you would think after beating them by 19 points, they would not come back as hard as they did in this legislative session, but this is not the case. You know, we're already seeing bans on care, on abortion care, bans on telemedicine abortion. We're seeing bills that will increase the funding to crisis pregnancy centers, which we know are, you know, their sole purpose is to dissuade patients away from having abortions. Oftentimes they don't even have licensed medical staff in their facilities. And there are actually two bills that are being heard today, HB 2135 and SB 96, in both the House and Senate. And those bills would give tax incentives to people who donate to crisis pregnancy centers. I'm putting in the chat right now a form so you can contact your legislators and tell them to vote no on those bills. And, you know, we're also continuing to see attacks on trans Kansans. You know, there's been a ban on gender affirming care for Kansans under 21 introduced. There's been a ban on trans sports introduced, as they've done the past 2 years. So really the work just hasn't stopped. It's going to continue, not only with a busy legislative session, but just going forward. I would just give a plug to follow all of us on socials, all of our organizations, because I'm sure we'll keep you informed there, and even about an opportunity to come to Topeka and talk to your legislators and march. Some of us are working on. So yeah, I'm just glad that we're all still working on this together, because there's a lot of work to be done, and we're excited for you to keep joining us in on it.
Thank you.
I can build off a little of what Lauren said. We're in a lot of meetings together, actually discussing all of this legislation, and we are working together to plan. Our organizations are working together with a few other orgs to plan that lobby day. I'm not sure how many of the folks joining us today are active students, but URGE does have a chapter at KU. So if you would like to stay involved with us, they're called SURGE, Students United for Reproductive Justice. I was trying to look up their Instagram handle before I came off mute, but I could not find it. But our friends here with the Emily Taylor Center work really closely with them and can help you get connected if you're interested in that. And we don't have a date yet, like Lauren said. I don't know where I got Linda from, sorry. For Advocacy Day, we are hoping for March, but I am going to drop a registration link in case you are interested. It's not hyperlinked. I will work on hyperlinking it when I go off mute, but we're collecting information for like just anybody who's like knows they want to attend and the date doesn't matter as much, because like we want to like try to get as many people plugged into the legislative process as possible. And thank you, Nikita and Megan, for dropping the SURGE information there. So if you're interested, like reach out to either of these folks or DM the Instagram page and they'll get you set up. I think they meet bi-weekly on Mondays or Tuesdays, but I could be wrong. I'm going to stop talking now.
Yes, can you still hear me?
Yes.
Okay. So Kansas Abortion Fund, we work in concert with the clinics, and to make that easier for the staff at the clinics, I mean, sorry about that. To make that easier for the clinics staff, I mean, they undergo such hellish days because everybody is so busy. We now are giving block grants to the clinics. For example, we'll give Trust Women or Planned Parenthood or some of the newer clinics that are arising in Kansas. We give them a monthly block grant. And if they need more money, all they have to do is ask us and we'll increase that block grant. They don't have to call us every time for a patient. They know our criteria, which is very easy, and they can work off of that. It just makes things so much easier for them. Also, we are we're learning about the new clinics through telemedicine that we're now working with, Abortion on Demand and RAM Medical here in Kansas, and we're now working with them. And the telemedicine is changing our landscape for sure. And I wanted to thank you all while I have the chance, Pere, and everybody who put this together today. I wanted to thank you so much for inviting us as a panel.
Absolutely, and thank you as well. We're happy to have you here. I know you're having some challenges, Rija, so I'm not picking on you, I just wanted to ensure you're there with us.
Yeah,
Okay.
no worries. I was just going to say that Vote Neigh is kind of just that online resource that you can kind of go to for like bill explainers. We just posted one on our Instagram, but I would definitely stay up to date with these awesome organizations for ways that you can get involved. But we are a great online source if you want a little breakdown of what's going on or just some news updates. Thank you.
Thank you so much. I know thank you so much, everyone. And I know we're at that time, we're at that spot, but we might be able to have one question, one small, simple question, maybe, or two simple questions, maybe. So I'd like to open up the room, the questions and answers. So if you have a question, you have a comment, you want to speak directly to the panelists, please use this opportunity. We're happy to hear from you.
Here, do you see the one in the chat there from Amy Wilson?
Yes, yes. Would you like me to read this?
Yeah, I think that's probably the best.
Okay, yes. So we have Amy Wilson, also my professor, shout out. So ask the question. So thank you for your work and for sharing your experiences with us today. Sandy mentioned the importance of stories with regard to bodily autonomy. I'd like to hear the panelists say more about that. What role did stories and storytelling play in your organizing and advocacy? Great question, thank you. What role did stories and storytelling play in your organizing and advocacy?
I can chime in with just even a small way that it really shaped how we are communicating to voters at the doors and on the phones. One of the first things that was a part of those conversations was just asking, or our volunteers were sharing with voters why they were voting no. And I think that was a really important way to not only just share if someone had received abortion care themselves and wanted to share their story, or if they knew someone who else had been impacted, or just share, why this impacted them, because it impacts all of us. So I think that's just a really small way that we made sure that people were able to share their story and then encourage voters to share theirs with them as well.
I think with an issue like with abortion, and then of course, like more so trans rights now in these days, it's important to humanize the issue, because the main strategy of the other side is to dehumanize real people who are just like looking to survive. Abortion is a means of survival. Gender healthcare is a means of survival for a lot of people. And so being able to just put all of the heated rhetoric that we see in the media aside and listen to somebody and listen to the emotion that is in their voice when they're sharing a story, like really hits people differently. It doesn't talk to their brain, it talks to their heart. And that's how a lot of people really get super motivated to turn out and vote. And I know in a lot of the early organizing before we launched our like full scale like door-to-door electoral campaign, we tried to connect people with storytellers through like our organizations under the KCF umbrella. It was like one of those, like, it was KCF, but not really, because like anybody was invited, but just like to help ground our like even more like rock star, like consistent volunteers in like the realities of the issue that we're dealing with.
Just briefly, there are so many stories. Oh my gosh. And, we feel great that we have been able to help a trans man with his abortion. And also the person who was a retired Marine who had PTSD and served in Iraq, who was basically undergoing some extensive mental health care because of her PTSD, and we were able to help her. Yeah, I mean, these are just some of the stories, and I think it's really important for the public and people at large to hear some of these. And although we don't share a lot of those stories unless we're able to, but I just really admire the groups, Planned Parenthood and the other groups that are willing to share some of those.
Thank you. Anyone else want to speak to storytelling even as a strategy?
This is Melinda. I think it's an important strategy in getting people that are on the fence and haven't quite made a decision or don't think that they know anybody that's had an abortion, even though statistically they do. I do know that there is a certain population that they don't care. They don't care. I serve on the maternal mortality review panel. They do not care, or they would not be doing this. So there is definitely that group of people that stories will not affect. And my focus was mitigating their power and ability and their votes, was kind of how I looked at it. And it was great to just be able to refer people to Planned Parenthood, and if they were younger, to Urge, because they did have storytelling support and trainers and events that were really impactful to the right people. And I'll go ahead and answer the next one real quick. What did I learn? Well, we're all good at different things. And I had a much better understanding, like, why doesn't Planned Parenthood just run abortion supportive candidates, right? Well, they're busy providing care. What's KAF doing? Trying to help poor people pay for their abortions. So it also really helped me better understand where I could be more effective in the next couple of years.
Yep, thank you. Tim, you can, yeah, are you going to ask your question in the chat?
Oh,
Your
yeah,
hand
no,
is-
I just,
okay.
yeah, sorry, I just asked the question. Like, you guys talked a lot about collaborating with each other, but I was wondering sort of, okay, collaborations are wonderful and great, and you all benefited from them immensely, but what's like a specific lesson, like for other organizers, that you might be able to share about like what made the collaborations work, and like what maybe is a lesson that you learned of like what doesn't make collaborations work so well? Like, do you have any lessons that you could share with us?
Infighting stays inside, or leftist infighting, as Fox News would call it. But that's the quiet part. And that's where it stays.
I'm actually going to share a book in the chat that I use. I agree with Melinda, like, don't want to cut that point off, but I'm just like really eager. I try to share this book anytime I get. It's called Emergent Strategy by Adrienne Marie Brown. And it's based in Black feminist theory, but also like in futurism, like being able to look to the future and like decide what are our actions now that will affect the future, and like, is it going in the direction that we want to go? And it does dive into some more of the like nitty gritty, like how to structure an agenda so that like we can hold each other in care, and like how to react to something in the moment, like, oh, maybe this agenda is not what we need because there's something more emergent happening. We got to deal with this. This will help us get to our goals rather than this plan we set 2 weeks ago. So I'm going to drop the title of that book in the chat. I refer back to it all the time.
I just add,
Yep.
I think one of the biggest pieces is like, I have so much trust for everyone here, you know, like at the end of the day, maybe we don't agree on everything, but you know, we do know that we're all grounded in the same goal, you know, which is just to defend abortion access and eventually expand it in our state. And so really coming back to that, knowing that we're all coming from the same place and just have so much shared trust for each other, I think that's what even when there are some difficult times. That's kind of what keeps us going and working together.
Yeah, that's so true. And just 3 words, we're stronger together.
I love those words. We are. And with this, I would like to say thank you all once again. I would like to hand the conversation over to Nikita. And, yes, let her take over. But once again, I really appreciate you taking the time. And I hope that the persons who attended today really got the opportunity to see some of the faces and hear some of the strategies that, may have influenced them in ways that they didn't realize until today, I guess. So thank you. Nikita, Megan?
Yes, thank you all so much for this wonderful conversation. Thank you to all of our panelists. Thank you to our moderator. This was very knowledgeable and productive, and we really appreciate you all. One thing I did want to say, as we were talking about resources and books, the Emily Taylor Center, we will be unveiling our Dr. Toni Morrison Library in March. So some of these book titles that were mentioned in the chat, KU students, staff, and faculty will be able to access our library and check those out. The library has a multitude of literature and works for you to continue to engage with feminist practice, and more specifically with this called Reproductive Justice and Reproductive Rights. Thank you all again. And
Nikita, can I jump in for 1 second?
Oh, yes.
Thank you. I'm Meg Williams. I'm the Assistant Director of the Emily Taylor Center and work with Nikita over there. We just wanted to mention that as university staff and university units, we encourage everyone to exercise your right to vote, but we do so in a nonpartisan way. So just wanted to make that clear. And if anybody is looking for resources, you can connect with Kate Kemper, who's one of the co-organizers of this series, or the Center for Service Learning. So just wanted to put that out there. And again, join my colleagues in thanking everyone for attending, participating. This was a wonderful panel, and I hope we all can continue this conversation.
Thanks, everybody.
And passing it off to Emily as well.
Yes, thank you.
I actually had a very similar comment, just word from our sponsors, but yeah, so that we can maintain this platform to be able to continue to have events like that. Just one thing to keep in mind. So thanks, everybody. We'll be back next month with another event in the Educate and Act series. We're really grateful to all of you today. Thank you so much.